if you dive into a fast and say, oh, I'm not going to eat anything for XY number of days, that is excessive, you're going to be sick, very ill. So it's not something to just dive without thinking and planning carefully, certainly without proper supervision. So so those are some of the potential benefits of fasting. Some authorities believe it might help to reduce the risk of conditions like type 2 diabetes or heart conditions and so on. However, I also need to mention, because I found this reference in a study, that they looked at a meta-analysis. They put together a group of different studies and tried to see, on average, what are these studies telling us about fasting and its effect on these conditions. And they said that particular big study suggested there was no impact of fasting, like intermittent fasting, on blood pressure and glucose levels. So this is something I want to really pull in your ear, because this is what we find in the medical community, that you may have a group of people that have a particular opinion and believe this is what we think. We've done our studies. This is what we think. X has this effect. On the other hand, another group of people in the same medical community will do their own research and say, no, actually, this doesn't have that effect. And so you have two different lines of thought, and you now have to wonder what's responsible for the difference, because which should we go with? And to be honest with you, that is where we are with a lot of these things. Either we don't have enough studies, or we have two different lines of thought, and you can't really make a concrete decision as a result. Okay, so we've looked at the benefits. Let us have a look at let's have a look at the risks. I think it's useful to balance the discussion and say that if you're fasting, if you're not doing it right, if you're doing it excessively, if you're not even supposed to be fasting, you may experience side effects, feeling unwell, experiencing headaches, tiredness, constipation. You might develop excessive weight loss. You might find that if you're doing intermittent fasting, you might overeat and indulge in unhealthy food during your eating window. So if you're doing the 16-8 intermittent fast, for example, what you might find is that because you're maybe not prepared for it, or you're not mentally ready, whichever the case, you find that you've effectively starved yourself for 16 hours. Then when it comes to the 8 hours, you think, right, you're ready now, and you think that's the time to wolf so much down. But that's not the point. The point is, even though that is your eating window, you are still supposed to eat healthily. You're still supposed to eat with moderation. And it is not an excuse to put in excessive amounts of unhealthy food into that 8-hour window because you've starved yourself for 16 hours. So that could be one effect that that's a clear example of somebody who is not carrying out their intermittent fasting properly. It's not going to work, and it could be very harmful. Okay. What else? It could, people with certain medical conditions or health conditions, or they're taking certain medication, people who have eating disorders, people who are elderly, pregnant, breastfeeding, or trying to have a baby. Those individuals are at greater risk if they're undergoing a fast, so they should not. Fasting is not for them, or if at all, it has to be very well regulated with their medical practitioner or dietitian to help to identify what is appropriate for them to be eating. Okay, guys, thank you so much for watching. Please don't forget to give this video a like, and of course, a comment or question, very much welcome. Let me know your thoughts. I know that we have different ideas around fasting and fibroids. Please let me know what you think. So we've looked at the benefits, we've looked at the effects of fasting and fibroids. We've looked at what fasting does in the body, really. So I think this is a good place to sort of, address the question